Hello, hello, welcome. Thanks for sticking around for this late afternoon session. I know we have a long night ahead of us, but appreciate you being here. A bit of housekeeping before we get started. We are going to be taking Q&A at the end, so please scan the QR code. You should know how to do it better than I do. And it should populate on the iPad so we can take questions at the end. Alternatively, if you can't do that, come up to the microphone, but we do prefer that you scan the QR code. I'm Anastasia. I'm a senior writer at Fierce Healthcare. I'm going to be moderating today's discussion, and we're going to have everybody introduce themselves, talk about what they do, what their organizations do, and then we'll get to the discussion.
These are different mics. Is mine on? Yeah, it is. My name's Katie Rudek. I am VP of Clinical Integration at Kooth. Our product is Saluna by Kooth. We are a preventative mental health app for young people. My history is I'm a licensed mental health professional with 10 years experience providing therapeutic services to young people. Thanks.
Good afternoon, everyone. My name is Dr. Jamie Banks. I am the interim chief of student support services for the School District of Philadelphia. So that includes our mental health services, our Tier 1 climate programming, our discipline, student voice, family engagement, as well as enrollment and placement for the school district. My background, I'm a clinical and school psychologist by trade, and I've been in program implementation for 15 years.
I'm Jennifer Huberty. I am a fractional chief science officer and founder and CEO of Fit Minded. We're a science consulting service. I spent 20 years in research and academics and left for industry, where I spent 5 years as the director of science at COM. And now I'm working with digital mental health companies, helping use science to increase their markets, credibility, drive revenue. And within that, I've worked very deeply with mental health in youth.
Good to see everyone here. I'm Harris. I lead a coalition of private companies and government people and universities and philanthropies around a brain economy transformation. So it's a big, bold idea that the cost of mental and neurological conditions across the lifespan is too high. It's 2.2 trillion to the global economy. It's rising at 5% a year. So we need a systems change approach, a big economic transformation to try to bend that curve and try to prevent and minimize this massive economic and human cost. And so I spend my days thinking about how to articulate this transformation, how to drive it, think about it in different sectors, in health sector, in social, in climate, et cetera, and how to work with partners in that. So I do that through Rice University in Houston, Texas. We also have an entity called the Brain Capital Alliance, which is a global entity which we use to work with Europe and stakeholders in Latin America and Africa and Southeast Asia. I'm an advisor to Kooth, I should say that. And anyway, it's good to meet everyone. My training is, I'm a physician by training, trained in mental health and psychiatry. Then I went into neuroscience, have a PhD, and worked in startup land as a chief medical officer and strategic executive. And now I really have touched all parts of the elephant, and now I'm trying to think through this economic transformation. So thank you.
Amazing, thank you. By the way, for anyone who's just joining us, there are plenty of seats on this side, so don't be shy. Feel free to make your way over, because you'll be standing for a long time. So to start with something broad, I want to define the status quo for children's mental health today. What is the state of children's mental health? Maybe what's making it worse, and who should be responsible for taking care of it?
Yeah, I don't mind starting with this one. Currently, in order for a young person to get help, they have to be experiencing a diagnosable mental illness in most cases. So that means that something that may have started small has grown into something that is causing them so much suffering and functional impairment that they can be diagnosed with mental illness. It would be very valuable to start thinking, and of course you all probably know this because you're at this speaking event, it would be very advantageous for us to begin starting very much further upstream by providing some preventative interventions to avoid that decline in functioning and in that increase in suffering that's going on.
I mean, I would add to that. I mean, and you all are aware that mental health and youth issues have been growing, right? The pandemic just exacerbated what was already occurring, what I already saw in my schools. And so, you know, I'm thinking about your last question about who's responsible. Everybody, like everyone has to be in this. We have to move away from the thought that only licensed clinicians can be the only answer. They are part of the answer. They are a big part of the answer, and we need to strengthen those pipelines. But it's also how are we equipping all the other people that are in the lives of our young people to, you know, love, support, help them through, and know when something's bigger that they need to, you know, pass it on to someone else. But you know, we've taken the approach that we have to really integrate this support into everything we do for kids and make sure and expand the training and supports that we're giving to, you know, preschool, to aftercare, to all those other agencies and organizations that are supporting kids.
Yeah, I think what Jamie is saying is very important. I think, you know, there's so many levels, right? It's interrelationship support with peers and those relationships, and then it's in schools, it's in families. When you think about it from the science side, there's a lot of areas that people don't touch because they say it's too difficult. It's too difficult to do family-based interventions. It's too difficult to do. But if we keep saying it's too difficult, how are we going to get anywhere? Somebody's got to step in and put the big girl panties on and get it done, right? So I think it's very important that there are so many different levels of, and where we're all responsible for this. And I'll add one thing, and I'm probably opening up a huge can of worms, but obviously our phones and social media. And it's like, I just wrote a piece on this that's going to be published any day, but, you know, with youth specifically, it's like bans and those kinds of things. It's like we're still not taking responsibility. It's not going away. So what are we going to do about it? And then it's taking the time, the effort, the energy, the resources to teach youth how to self-regulate, I'm looking at something and it's making me feel bad. I should put this down right now. Somebody's got to teach it to them, right? So.
That's a good can of worms to open. And
let's go.
Yes. So my additional points would be that obviously working with the education sector is critical. That's why it's great to have Jamie here, because she lives and breathes in that world. So that's essential. And then if we think also, you know, get to digital, we think also beyond that, what's the role of food systems? Ultra-processed foods we know are increasingly toxic to our microbiome and associated with the onset of depression and anxiety. We can also think, really what I do is think across sectors. So what's the role of food systems? What's the role of climate change? We know that is a sort of area of anxiety for kids and an area of actual trauma. So that is relevant. This is really whole of society stuff. And maybe one last point is the role of design and architecture. It's interesting when you get into that field, you know that a lot of buildings are not designed with the brain in mind. They're very basically environments that can make you more stressed if they're too noisy or they don't have enough sensory room type activities. So neurodesign and neuroarchitecture is this other area where we could potentially engage the design, development, and architecture world. So I think that's my cherry on the top.
Great, thank you. And speaking of, everybody, Jamie, you mentioned everybody is responsible for taking care of kid health. I know each of you have a very unique perspective and where you sit in the system, and I'm sure a lot of your work is enabled by partnerships. Talk about what levers you're pulling to reach across the aisle, to work collaboratively, and how that is really important in moving the needle in the space.
Sure. Partnerships are everything. There's no way I can move the needle. There's no way I can extend our continuum without them. But not just any partnerships. I tell my teams I need good partnerships, meaning the communication's going both ways. And guess what? You're not just giving me a product. We are building together. And so we've prided ourselves on increasing these types of partnerships in our school district, which has led to kind of just more mental health supports and services. So we have a behavioral health provider in every school in the city of Philadelphia. We then have additional services, again, through these partnerships that are helping, excuse me, in different ways, whether it be helping to train the counselors that I have in our schools, whether it be to add additional supportive services, whether it be to help with recess so that recess is actually structured as well as beneficial in the way in which we know the research has shown it can be, but we could teach schools how to do it. I couldn't do any of this without partnerships. So we really just lean in, but we need to make sure that they're right partnerships, and that's what we have doubled down on.
Yeah, and I think even bouncing off the partnerships, it's like from my angle, sitting in science and research is like evaluating these things and are they working, and the resources that we're spending on them, are we seeing changes? Are we seeing improvements? And whether we are or we are not, we are taking that information and bettering what we're doing, right? So we can consistently be informing ourselves so that we can continue to do better. And you also have to have partnerships to do that. Sometimes it's universities, sometimes med centers, sometimes it's just org to org, right? But again, we have to be doing.
I will say we now, before an MOU or contract is signed, we're talking about how we are measuring what we're doing, and we're starting it at the beginning in the conversation.
Exactly.
So it's no surprise later, or what are we focusing on? No, what are we going to measure from the beginning so that we can have data that shows what we're doing, or data that shows that this isn't working, so I can say, I'm sorry, this isn't for us, because everything isn't.
And one little thing to add to that is that those who are engaged with what you do with the information you're learning should be youth. Those who are, the youth should also be engaged with, like, what things should we be measuring? Like, the youth can say these things. They're human beings. They have minds, they have thoughts and feelings, and we should be including them in what we do and how we do it. Absolutely.
Yeah, we certainly should. And schools and mental health agencies everywhere are so overburdened and overtaxed with the mental health crisis and the need out there. In order to meet the need, we have to leverage partnerships, and really we have to leverage this digital mental health space that we're all here talking about in order to reach everyone who needs support.
Maybe I'll just add, in youth mental health, I think partnerships between private companies and government are essential. We have, for too long in the digital mental health field, developed solutions that are only for people that can afford them, people with really either can pay cash or people that have really good plans. So working with government and is critical to figuring out how do you get that payment for the service so the company can provide services to people in low middle income contexts. So that means, for people like us is thinking through how to engage politicians, bureaucrats in a conversation about public-private partnerships, that government's not solving these problems, right? Government's not like Silicon Valley, and it's never going to be like that, but there has to be a partnership and mutual respect and understanding. And this is also something we need to raise awareness for in the general community as well, that public-private partnerships are critical. And you can also potentially, and I'll stop here, is sprinkle in some philanthropy. If philanthropy wants to have impact, they can help to educate the private side and the government side on how to do this, and maybe they can throw in some money to try to de-risk it or grease the wheels of how to get more fruitful, impactful public-private partnership going.
Great. Katie, you mentioned digital tools, and I do want to turn to that. We've heard a lot at this conference about the power of technology and health tech, obviously with its own drawbacks, but how is this population responding to technology, and how are you using digital tools to meet access gaps?
Yeah, so in order to reach youth, we really need to meet them where they are and where they want to be accessing us. And right now, that's in their devices. They want to have something that's easy, that's in the palm of their hand, where they can grab it, not have to plan ahead, and get immediate access right now. So I think having something that's so easily accessible, like a mental health app, that a young person can just open up and get what they need out of it, navigate it the way that they want to, it can make a significant difference with access, especially thinking about rural communities where there may not be a provider anywhere near them. Leveraging that digital space is is super helpful.
I would say we don't really know the answer to the question, to be honest. If you take just this, again, the scientists in the room, like there's no evidence in in any direction, really. I mean, if you take social media and phones and using them for good, like there's half that say, okay, this is a way to teach and support and have it be a positive thing. And then there's the other half that says, this is negative, this is horrible, this is ruining our youth. It's like, well, scientifically, if you look at the evidence, we don't really know. Nobody really knows. And the other thing is, I think we have to be so super careful, and I know just for the sake of the panel, it's youth, right? But let's be honest, every community, every state, every city, every rural, like they're all different. They all have different problems, different family lives, different this, different that. So it's like, it's N equals 1 always. So how are we going to do the best job when it's really N equals 1?
That's a
so
good point.
Yeah, so it's like, yes, we're doing the best we can, absolutely, but we can do better, and we have to be thinking about these things. So that's the science.
Yeah, I think that's an excellent point, and I love that you said N equals 1. We're looking at individuals here, and everybody's got an individual perspective and an individual experience. It's just a great way to wrap it up.
Jennifer, you mentioned that it's important to include students in these conversations in the development and deployment process. Maybe you can give some examples of how to do that and how to collect that feedback and make them feel heard?
Yeah, I mean, I think you develop, just like you would with adults, like advisories, right? Or some type of ambassador or some kind of groups that kids can engage with, and then you bring it to them. This is what we're thinking. What do you think? Right? And sometimes you might just talk one-to-one, and sometimes you might talk in a group, because it can work either way, right? They can be sometimes they'll be more honest in a one-to-one to give you feedback versus when their friends are sitting in the room. Again, it can go either way. It depends on resources, all those things, but yeah.
I would say we've, with the vendor, we had the vendor present to the youth and said, I've already seen the presentation. I think it, would be helpful, would not be helpful, but let me see you present to our youth. And our youth came, they listened, and they asked some zingers. Like they were ready. They were ready. And I also wanted to see how the vendor responded to the youth, because that's important to me, right, in real time. And then when the vendor left, talk to the kids. What are the pros? What are the strengths? What are you concerned about? Do you think your friends would use it? Do you think who wouldn't use it, right? And we help that information to inform our decision to move forward. But then it doesn't just stop there. Also, as you implement, right, we're continuing to use them, not just a survey, but help us roll this out, right? Help us continue to give feedback about what's going well, what's not. And so, I think there's multiple different ways to do it, of course, and I believe some group feedback, sometimes survey, sometimes individual, but really using their voice to lift it up so it actually is implemented, or if it's not implemented, you already know why, because they've told you.
Yeah. So one other thing I'll add to that is sometimes, this is adults too, we don't know what we don't know. So we can present something that sounds really cool, and we develop it, and we spend all the money and the resources, and then it's like, wah, wah, wah. This isn't exactly what I thought it was going to be, right? So then it's our job, all of us trying to make an impact in youth mental health, to go, okay, this stinks. Guess we're starting over, right? Or we're completely gutting this, right? Because that could happen. Or it's a hit and then you're in great shape, right? But I think we have to be thinking about that as well. You might have to completely change what you're doing.
Maybe to add, if you have a lot of resources, you can go to a big design company like Frog Design or IDEO. But if you don't have a lot of resources, you just want to get started, you can probably ask GPT-4, what tips would you have for design thinking, engaging youth, or talk to friendly people like Jamie and go that way. So anyway, there's different ways of going about it, and I think there's from low cost to very high end.
Yeah, I love that idea. I wanted to turn to the social determinants of health, obviously very important for all populations, but I think children are particularly vulnerable because of their stage of the development. And what goes into considering the social drivers of health for kids, maybe privacy considerations related to screening for SDOH for this population, and wraparound services, as have already been mentioned, like how to facilitate referrals to social services. Anyone can start.
You want to take that one?
Goodness.
I'm good.
Of course, no. I think I'm always thinking about all the things that our students and families need. So I'm always talking about or thinking about the social determinants because I have rarely seen an identified problem, and when I unpack it, it is way more complicated and complex. It has to do with other things outside of what is in front of me. And so as I've built programs and supports, like one of our programs that we have built, we included a family peer position in the program. Why? It's an adult with lived experience, either themselves or supporting their own youth through the mental health kind of process in our city. They can speak to parents, connect parents in ways in which they don't want to hear from me. They don't want to hear from Dr. Jamie, right? Like, they want to hear from a peer. And so that's another way to continue to chip and support in a way in which then the family feels connected and heard. So constantly thinking about, all the different access points, all the different needs that our families have. And we're actually working on a project right now where we are looking at all the city supports and how are we communicating those supports to our families. Is it in a user-friendly way? Is it easy to access? Because we often create a lot of things and access is very hard, or it's written in a language that everyone doesn't necessarily understand. And so, I think you cannot do this work without lifting up the social determinants.
Maybe just give a macro answer. I think about less these days about mental health. I think about brain capital. Brain capital is a new economic asset that my colleagues and I are defining, which includes mental health, and brain skills. So the skills like creativity, analytical thinking, and then non-cognitive skills like resilience, adaptability. So I think about the social determinants of brain capital, and in my work, I typically think about it globally. We have a global brain capital dashboard where we look at the determinants, the social determinants of brain capital, environmental determinants, digital determinants, things like access to broadband. So that's a model that is, I think, interesting and relevant to this conversation. It'd be fascinating to think about a youth brain capital dashboard for the United States, to try to think about this state by state and even more localized as we, move into. So that's sort of a practical thing. And then I also think about what do you do about it? You can't just admire the problem. You can't just have a macro map of the sort of determinants of youth brain capital. What do you do about it? So we also think about systems change. So could we develop a youth brain capital systems change lab? Think sector by sector about 3 to 6 shifts that we might want to see in the US in food systems, in health, in schools, environment, and what are targets and indicators that we could go after to try to boost youth brain capital? Because then it's not just admiring the problem to try to generate action. And so as I think about the next, administration in the United States, or maybe it's just even at the state level, how can we inculcate this sort of big economic transformation thinking? I guess it's at national level, at state, and then at local, county level, and even smaller. So that's sort of where my mind goes to your question.
Yeah, and I think there's such a problem with disparate data collection in the country still, so it would be helpful to have a national outlook, but also a regional. Yeah,
and exactly, and siloing of the health system and the education system is one big issue. So how do we, that's part of the value, I think, of brain capital, is it just sort of leans together health and skills. And so it's sort of health sector, education, and labor markets, and tries to get data to be shared and pooled so we can get a better sense of insights, because these things are all interrelated. The brain is the seat of social skills, emotional skills, cognitive skills.
I know there's ongoing conversation about caregiver burnout and the importance of caregiver mental health, how important that is to the patient or the person they're caring for. Where do parents come in when it comes to youth mental health? How do you think about educating parents, involving them in their kids' mental well-being? And what is the best format to engage parents?
Yeah, so I think there's many ways to engage parents, but 80% of our time is spent at work, right? So you would hope that employers are doing something to support parents, caregivers, right, in these situations. And there are definitely those that are doing that, but I think we can do a better job once again. I think things have changed, since COVID about the way we view the work environment and the work day and, male versus female and like all the things, right? But yeah, I think it lies in the employers, especially because it's their selfish for them. It's in their best interest if they want to see productivity and, but I think, and actually one of my clients, we've looked and published on youth mental health and the impact on the caregiver. And just entry of a child into this digital mental health intervention, just entry, no outcomes reported, caregiver stress goes down, productivity goes up, burnout lessens, just entry. And then you could imagine what happens as the child is improving, so is the caregiver. So I think that there's evidence for it also.
It's interesting then to open up the question of how do you get corporates and organizations to do this? Is this a education, incentivization, regulation? Does anyone have any thoughts they want to share?
Well, just in the one case in which this example, it's offered, it's an offered program by the employer, right? So all their employees, yeah, and obviously they're paying for it. So, but yeah,
it's
I guess it just depends.
Enlightened company. Yeah. Maybe it's a bit of all of it, right? It's like, how do we get CEOs or chief human resource officers to take this seriously and recognize that there's a financial interest for them to support parents to be the best parents they can be to their kids. So it's an interesting educational question, and then maybe there are certain ways of looking at how to do it as a public health campaign.
I think the education point is so important, and I don't have all the answers, but it is the education for the parents. It's like, what do you do? What do I do if you're not going to get it from your employer, right? Like, or maybe you're not employed. I don't know. Like, what they definitely need support, and it's like, how am I supposed to handle this? What am I supposed to do? And education is a key piece, huge piece of this.
We often see with our kids, again, once you start peeling the onion, you see all of what's going on, and it often, lies with a parent or a loved one that's struggling with some sort of mental health need. And so, my staff's main job is to help connect, right? And sometimes it's, a situation where a parent just isn't connected or doesn't have anything to connect to, so we're having to figure out what that is. Other times, there are options, but they don't know how to choose. So maybe their employer does offer something, but maybe they also, can access Medicaid, so there's that, and they can do, and they're like, well, what to do, right? And so I think sometimes it's that helpful person, whether it be the therapist going the extra mile, whether it be the case manager that we have, or the family peer, walking through those options. And that in itself, we've also then seen sometimes, you do see changes in the child almost immediately. Not that we've cured everything, but some of the stress that has been on the child, seeing that their parent's needs aren't getting met, like that in itself helps that. And so, again, we have complex systems with not always although there's answers and there's things that can be done, that connection of a person to product, person to service doesn't always happen. And so there has to be more folks that can do that, so that the services we do have actually get utilized. So that's what I hear from a lot of folks, right? We have a lot of services, but it doesn't mean that everything's being used.
Yeah, I love how you connected it from, we look a lot at how does the parent impact the child's mental health, but then you brought up this great point of how does the child's mental health impact the parent, and then this cycle that happens, and then where do we interrupt this cycle, and where do we insert an intervention, and then educate them about how to access it. That's such a valid point.
And then to go like a step further, if we worked more upstream, right, and we embedded some of these skills and practices, at birth, right, when the parent is just becoming a parent, right, and we poured more into that space, I think it would make the connection between services and supports later, if necessary, not as challenging.
I think just one add to that is like this family, if you look in the literature and research, nobody really wants to touch the family interventions because they're resource heavy, you got to go knock on every door, show up, like whatever, you have to be there. But again, it's all back to the first topic. It's all of our responsibility and somebody's got to do it. But on the science side, there's a lot of evidence in positive direction for these family interventions, literally like one at a time. It's back also to the N=1, right? So the trauma that's happening or whatever's going on with the parent or the child, right? It's going to keep going until we do that. So
I wonder, Jen, you might be the best person to answer. Is there any financial ROI data on parental support for parental support for their kids for the parent's business? Is there, there's science for it clinically, but is there financial ROI data that we can take to CEOs and CFOs and convince them to put more resources into this? Yeah,
so in the example I was using earlier, we're just now looking at some of that stuff, but you can insinuate that if they're increasing their productivity, they're having less sick days, like obviously that's return on investment. And yeah, like I said, the only thing it is entry of their child into something. That's it. You don't even have to see effects or any changes yet. My child's being taken care of. I can at least go to work and bring home my paycheck.
Yes, the tone of despair in a parent's voice when they would hear my voice on the other end of the phone when I would call them from like my therapist's office or my level 3 EBD room where I spent 5 years working was just like, oh, I have to come in again. Like they have to leave work and stop what they're doing. They're probably not able to do that, but they have to do it anyway. And yeah, it's just so very, very impactful. And it makes a big difference in what they can do at their job.
Jamie, you talked about how it can be difficult for parents to find care, get connected to care, and I'm sure that's the case for kids to an extent. Apart from school counselors, what role do teachers play in letting people know about the services available?
Yeah, as I kind of started, everyone's in this. In different ways. I'm not expecting my teachers to be counselors, right, or therapists. But everything from getting to know your kids in your class, getting to know the families, that's everything. Like, that is everything. They will find out things before it rises to a counselor, right? And that's how that detection and connection to services can happen. To implementing kind of, basic SEL type of curriculum into, their teaching practices, not SEL on Tuesdays. We're talking about it integrated into our everyday, how we are supporting kids. Is everything. But it's not just the teachers. The custodian, the lunch lady, the safety person, all those people in schools matter. Kids who have at least one trusting, adult that they can identify have been shown in research, right, to do better. So that person might be your counselor, but guess what? There's 1 or 2 counselors for 300, 500 kids. So there's other loving, caring adults that can help support them, but we just need to make sure that they're equipped to support, as well as knowing, again, I'm always going to say, what's in their locus of control to kind of deal with, and what needs to be increased to someone else.
And it's important, some, pre-series, Series A that are in this market and trying to do these things. It's like, I have companies, it's like, oh, we'll just partner, we'll get into a school, we'll sell to a school, and it's like, okay, well, that's not going to solve, just go to school, okay, but then there's all the things. There's the lunch lady, there's the teachers, just because the principal says, or the superintendent says, oh yeah, we're going to do this. That has nothing to do with a third grade teacher at 1 o'clock when they're supposed to be doing something. If, literally I've had excuses like my knees hurt that day. So it's like, okay, so again, no blame on anybody, but it's not that easy, right? There's so much.
It's not. That's why I say partnership is all.
Exactly,
so just don't come with the
exactly.
package thing. I'm like,
That's right.
How does that work here? And I need you to do the research on what here means,
it's
right?
it's the hand holding, okay, here's the app, hand it over. We know that doesn't work. It just doesn't work. You have to come inside, get to know people, N=1 again, figure out their organization, the structure, there's so many layers to it. And so we all can be doing our due diligence when we're growing our companies and our passions and our ideas with thinking about it more than let's just build this thing and sell it, right? There's so many layers.
Just thinking of it's the whole of school success. It's not just the superintendent, it's the whole of school.
Yeah, absolutely. Just a reminder before we near the end of the discussion to use the QR code on the screen to submit your questions. I will have them on the iPad here ready to answer. As a final question for now, Harrison, I love how you were thinking kind of systemically, looking at different stakeholders and what they can be doing, regulators, politicians, businesses. So what can states be doing at the policy level to enable mental health services for kids and parents?
I think it's a very good question in the context of what we're going through today and tomorrow at the federal level. And I'm an Australian, so I can bring these things up and no one's going to harm me. So we know, of course, that states are critical, right? They have budgets, and actually the interesting thing now there's a little bit of competition between states, which is great to see. I've learned this in youth mental health in particular, that states are seeing governors, lieutenant governors, state senators, state reps. They're seeing that youth brain capital is obviously a key asset to their future economy, right? If their future economy doesn't have smart people that have the right skills, they're not going to be successful in the future economy, which is about AI and such that we all know about. So California has weighed in a big deal, in a big way. They've put down some, over $5 billion into youth mental health to scale up beyond what they've originally done, and now there is basically parlaying between the states, so creating some competitive tension between Dems and GOP state governors and lieutenant governors, and so it's wonderful to see. And I have also enjoyed seeing the different types of channels, I would say, to get to these governors, lieutenant governors, senators, and reps. There are organizations for governors, lieutenant governors. Women in Government is another organization. So that they're very receptive, and I think that now is the time for us to jump in. That we can see certain states are putting down serious money to work with private companies, NGOs, etc. So we need to all sort of have a role in engaging in this. So hopefully some of those ideas and organizations are helpful. So,
I would say consistent funding, because what Jen just described, I can't get a school to buy into anything if they think it's going to be gone tomorrow. Bottom line. And if I have to guess every spring whether or not I'm going to have something or not, then they know, and I'm transparent, right? I can only move but so far, right? So, we have done things where we are a licensed mental health provider as a school district to help tap into Medicaid funding so I can sustain one program that I have. But, California, as you mentioned, has done a lot of work in that, freeing up more Medicaid dollars that schools can access so that it can fund things in a more sustainable, reliable way. So we've been pushing our state folks for PA to kind of join in on that. But in addition to that, we just need kind of, again, more funding, more consistently, so that we can really plan for the future. Otherwise, we do a lot of starting, stopping, and can't really use your lessons learned because you have to start all over again, and new people change. And
I think this gets back to partnerships again. So at the state government level, where are you getting your funding from? And you should think broadly, right? Are you getting funding from the health part of the state government or the education part? There may be some others as well. But that this is a real risk that government funding cycles, governments can change course. They can issue massive contracts and then they can just decide for political reasons to stop that. That's where the role of the private sector, private payers need to come in. It's not a sugar rush. This is a sustained thing. And then I think the final piece is philanthropy as well. Philanthropy is this gift that America has that we don't have in other parts of the world. Australia doesn't have very much of it, but there are, philanthropy can help to kind of set expectations and set, startup solution providers, government and private payers up for sustainability. And that involves education on all these different stakeholder groups.
Yeah, I'm glad you brought up payers. One of the questions that has come in is, what progress have you seen with health plans recognizing the health and financial benefits of supporting caregivers of their members, and what are the obstacles to doing more? Basically, if you've worked with payers, what has the reception been in this area?
I don't have an answer to the question of payers supporting caregivers. There are programs for the whole family, but then again, you're relying on a diagnosis. In order for a baby or a toddler to receive help, they either have to diagnose a 2-year-old or diagnose the parent with a mental illness. Like, this should not be the way we're looking at it. We should be looking at this as this is a fundamental element of health. There's this program called Attachment and Biobehavioral Catch-Up. It's just phenomenal, and it's not something I do, but it's something that I'm very familiar with, and it teaches parents how to engage with their baby, toddler, and child to give them the skills that they need, starting in the very beginning, to be able to attach, to be able to have healthy emotional expression and emotion regulation. And in order to access it, you have to be diagnosed. It's just, it needs to be addressed at a different level. And I think there is a movement toward value-based care, toward population health, but that movement is happening very slowly, and in order to access it, it's quite complex. But I think there's hope. Yeah.
I'd like to ask Solomé that question that you asked us, because I think she would have a good answer to it. I think there's definitely, serious activity with private payers in youth mental health now. We see lots of deals being made with private payers and startups, and then private payers and governments and startups. So that there's hope there. Whether the private payers have gotten interested in caregiver issues for youth mental health, like the parents, I haven't seen a lot of that, but other people would be better placed to answer that.
It is happening. It's just slow.
I think the Surgeon General, when I think about this topic that we're talking about, the Surgeon General has done a great job of breaking the ice on this discussion and driving some change. But whether that amounts to dollars and cents from private payers is the question.
Yeah. Well, for our final question, what mental health challenges are unique to caregivers or parents that aren't necessarily addressed by the mental health solutions that are available today? Or how are their needs different?
I can just talk a little bit about some of the in some of the research that we've done, but and some of these are kind of obvious. Stress levels are just like through the roof, right? It's just like stress and no sleep, right, because of the stress, or vice versa. And I think it's like when it depends. Again, it also depends on where their child is falling with symptoms and how severe they are, right? If you have a kid with suicidal thoughts, and I mean, if you don't know what to do, you're in a complete panic, right? So, yeah, I don't know if you want to.
Yeah, I would say like dual diagnosis,
Yeah.
you're not just usually treating one thing, right? There may be some mental health, there may be some substance abuse, there may be kind of a couple other things going on that you have to identify, or whomever is supporting, but even us have to identify who should support first, because it's not always the one person they can go to for all of that. So I would say that's the most frequent. Or deciding, like, yes, there's co-occurring, but like really the housing is really key first. So let's go there. It's just, again, multiple factors that you have to deal with in real time.
Right, and it's depending upon all those things, like where do they live and where's all the different levels, right? So that's what the symptoms are going to be. That's what the outcomes, all those things change in different situations.
Maybe one additional point to add is that if you're a caregiver for a youth with mental health challenges, you're quite likely to also be a caregiver for a parent that is aging, has frailty or some kind of medical illness. So people in the sandwich generation, mostly women, are particularly susceptible to or vulnerable to burnout and caregiver stress. And so we also have to remember that sort of the geriatric population impacts, and dementia issues and neurodegeneration impacts people in the sandwich generation that are copying it from both ways, and then maybe trying to have a job, and there's a lot. So.
Yeah, that's a really great point. Well, thank you so much. This was an amazing discussion. Really appreciate the audience too.